Hey guys, welcome back for another episode of 5 Minute EMS Review. Today we are talking about the memory aid OPQRST, which is useful in helping us determine the history of the patient's present illness. Now, we alluded to the OPQRST in a number of our secondary assessment videos, so today we're going to get into it a little bit deeper. Now, I hear OPQRST mentioned a lot in reference to determining some of the information that we need to know for patients who are experiencing chest pain, but really it can be useful in any type of medical situation to help us learn when the illness started and some of the other factors relating to the illness. So let's dig into it a little bit. First off is the O for onset. And basically what we want to get into here is what was the patient doing when the onset of the illness came about? If it is chest pain, what were they doing when the chest pain started? If it's shortness of breath, what were they doing that led up to the onset of the shortness of breath? So we want to try to have an understanding of the context that may have led to the symptoms or the chief complaint. So that is the O. The P is for provocation and palliation. So when we say provocation, we're talking about provoking. What provokes the pain or the complaint? If it's a pain, that's easy enough. What provokes the pain? If it's a complaint like shortness of breath, what provokes or makes the shortness of breath worse? So we want to look at, is there something that you do that makes your complaint worse? That's relevant to us. That might help us narrow down the cause. Or is there something that you can do that makes the pain or the complaint feel better? Can you palliate it? Can you make it better? If you sit down, does that make your complaint better? If you stop exerting yourself, if you sit up and instead of being in a supine position, does that make your complaint better? So P for provoke and palliate. Now, moving into the Q. Q is for quality. And basically in this one, we want to get the patient to describe the quality. Typically, we're talking about pain here. What is the quality of their pain? Is it sharp? Is it dull? Is it aching? Is it crushing? And we want to try to have this be an open-ended question as much as possible. Now, just like we talked about in our sample history video, sometimes patients aren't great at offering up information, and we may have to lead them a little bit. We may have to prompt them and say, is it a stabbing pain? Is it a crushing pain? But you want to try to get them to describe that pain in their own words as much as possible. Moving on to the R. R is for region and radiation. And again, this typically is referring to pain. And we're talking about where is the region of the body that you're experiencing the pain, and does it radiate or does it move from that region to anywhere else? These are key factors that might help us identify the cause and the location of the pain. S is for severity, and again, this is mostly just a pain scale that we're talking about here, and we use 1 to 10 to have them rate their pain. Now, obviously, if you're around any of the patients that I'm around, pretty much everybody is liking to rate it as a 9 or 10. But you want to try to encourage them to be realistic and think about where do you actually fall on this pain scale, with 10 being the worst pain that you can ever imagine. And then finally, after the severity is the T, OPQRST, for timing. And basically, we want to know, when did this start? How has it progressed over time? Has it gotten worse? Has it come and gone? Any components related to time and how the pain or the chief complaint has evolved or changed over time. And that does it for us. Onset, provocation, palliation, quality, region and radiation, severity, and timing. That's your OPQRST. And hopefully that will be helpful to you as you perform your secondary assessments. That does it for today. We appreciate you tuning in. Please share our channel with anyone else you think may enjoy it, and we hope you will join us for the next video. Thanks. See you next time.